Good morning, everybody, and thank you very much for joining. I'm Duncan Van Duzen. I'm the Executive Director with the Catch Global Foundation, and I'm pleased to have the opportunity to introduce our speakers today. So first, let me tell you just a word about the Catch Global Foundation. We're a 501c3 public charity that was formed earlier this year, and our mission is to disseminate and develop and sustain the Catch program. So we work closely with the team at the Dell Center and UT Health. You probably know something about the Dell Center, but let me tell you a little more. The Dell Center is a leader in research and program provision that helps stimulate healthy living for children and their families and communities. And the work of the Dell Center focuses on fostering improved health behaviors among youth, influencing policy and environmental change, and advancing professional education and community service. So the Dell Center is all about healthy children in a healthy world. And of course, Catch is a great example of a program that's been developed by the Dell Center. And Catch is also a program that coexists very well with Marathon Kids. And as you'll hear from Erica, Marathon Kids today is used in almost 1,000 schools in 13 major cities around the country, many of them in Texas. And probably most or many of those 1,000 schools also use Catch. So it's a great complement to, they're great complements to each other. Now, before I introduce Erica, let me just talk a little bit about Marathon Kids at a personal level, and I'll tell you a quick story. When my daughter was in kindergarten, they had a Marathon Kids program at her school, and she was very excited about it, and we went to the kickoff mile, which is usually held in August, and it's usually really, really hot here in Texas, and we had our water bottles, and we did our mile, and she thought that was pretty cool. And all during the fall and winter, she did her marathon a quarter mile at a time. We had a poster up on the fridge where she would diligently color in each section of the poster as she ran her mile. And finally it came time for the final mile, which is usually held in February. And it was a cold day, but she was really excited about it, and she woke up, and we thought she was a little bit listless, and we said, are you okay, Kate? And she said, oh, yes, I'm fine. And we went off to the final mile, and she did the final mile, and as soon as it was over, it looked like the blood was drained out of her face, and we went back to the car, and we said, are you sure you're okay? And she said, well, actually, I was feeling a little sick today, but I didn't want to tell you because I didn't want to miss the final mile here at Marathon Kids. And we got home, and she had like 103-degree fever. So the point is, such is the enthusiasm that children develop for the Marathon Kids program. She was very, very excited about it, and she was going to finish it no matter what. And she ended up getting her medal that year, and she got 5 more medals in grades 1 through 5. She, did it every year during her elementary school, and I'm pretty sure that somewhere in her closet are still hanging all 6 of those medals. And during the time that she did it, she also got the rest of our family exercising more. She, in order to complete her marathon, we would frequently go to the local high school track on Saturday mornings or Sunday mornings and log miles as a family. So we really all experienced the program together, and it's a great way of getting kids moving. It develops a lot of enthusiasm in individuals, develops a lot of enthusiasm in the school community. So again, we're really pleased to share space with Marathon Kids at many schools and have an opportunity to present with them today. So Erica is the National Director of Programs at Marathon Kids. And Marathon Kids goes back to 1995. It is the only evidence-based running and walking program for elementary schools in the United States. And it has a core program, the one I was referring to that my daughter did, which is the 26.2-mile challenge. Obviously, that's the length of a marathon. And like I said, it's now offered in 13 cities by almost 1,000 schools, and over 250,000 participating children every year. So it's grown to be quite an important program. Prior to working at Marathon Kids, Erica was a college coach and program director at College Forward, which is an AmeriCorps program that encourages college matriculation among disadvantaged high schoolers. And she holds a Master of Science in Communication Studies and Human Relations from TCU. So without further ado, let me pass it over to this morning's presenter, Erica Gordon.
All right. Thank you so much, Duncan. That was such a great introduction. I really appreciate it. And I had not heard that story about Kate. So tell her I'm sorry on behalf of all Marathon Kids that she had to walk away with 103-degree fever, but congratulations for finishing. That's really, really awesome. Thank you to Catch and the UT School of Public Health and the Michael and Susan Dell Center for Healthy Living. I really appreciate you guys having me on today. It's really exciting for us to be able to talk about all the work we've been doing over here at Marathon Kids for the past year and how we're sort of ramping up our programming around MVPA and its importance. So my hope for today is to take you all through a little bit of a journey that follows Marathon Kids through the past year. And while I will be, speaking specifically about MVPA and its importance as it relates to our organization and our program, I can personally tell you that this information is applicable everywhere. In fact, a lot of our own staff members here at Marathon Kids have really changed their lifestyles after we've gone through the research we have for the past year. So I hope you guys find it informative and ask questions along the way that we'll answer at the end here. So you can go to the next slide, Duncan. And I'm just going to start by telling you the goals of today, which is a brief overview of Marathon Kids. And Duncan, you covered most of this for me, so thank you. Just for those of you who don't know much about us, I'll let you know about our mission and our program. And then we're going to dive into today's reality and youth health and MVPA. And then finally, based on what we found out about MVPA, what are we as an organization doing about it? And we'll go through some things that we're doing today. So you can go to the next slide. Our mission is that we are an evidence-based nonprofit organization dedicated to improving the health of children by providing them the motivation, tools, and support in order to live healthier and happier lifestyles. And I put some of the words in our mission statement in orange on this slide on purpose because these words, improving the health of children and providing them the motivation, tools, and support, is really what got us into the research in the first place about a year ago, because we really wanted to feel that we were in fact improving the health of children given today's statistics and reality. And so you'll see throughout this journey how I keep coming back to our mission statement and asking ourselves the tough question of, are we in fact achieving our mission? You can go to the next slide. So a brief overview of our current program, which as you mentioned, Duncan, is called the 26.2 Mile Challenge. It is our school-based program, and we work in elementary schools, and K through 5th graders commit to running or walking 26.2 miles incrementally over the course of about 5 to 6 months. And it's really important that you understand that point, because this is what we used to tell folks when they decided that they wanted to implement Marathon Kids at their school. Your kids will run or walk 26.2 miles in quarter or half-mile increments over the course of 5 to 6 months. And we provided schools a mileage log so kids could track those miles, and with that mileage log was a fuel log. So kids would try new fruits and veggies and drink water instead of soda along the way to fuel their bodies throughout their journey. We also host a couple of big events, like you also mentioned, Duncan. We do that now in 7 of our marquee cities. We host a kickoff event and a finisher medal event where we bring the whole community together and celebrate the kids' beginning and end of their 26.2 miles. And we provide rewards and incentives along the way because we know that that's really important for long-term behavior adoption. So at the kickoff, our kids receive a water bottle to hydrate them, and at the finisher medal celebration, they receive that finisher medal that you talked about, Kate, being so proud of. And then all of our elementary marathon kids also get a finisher shirt, just like a real marathoner would once they finish their marathon. And up until today, our 26.2 Mile Challenge has really been focused on the child's experience. So making sure that the child is celebrated, constantly having fun, excited about physical activity. That's what we had really been focused on all throughout our 18-year history. You can go to the next slide. You also mentioned a lot of our journey, but really quickly, we were founded in 1995 by a woman named Kay Morris, who found a mileage log in Runner's Magazine and found it to be really motivating for herself. And so she thought, what if we gave this to kids? Would they find the joy of running like I have just by tracking their progress incrementally along the way? And she teamed up with some teachers in the Austin Independent School District, and together they started Marathon Kids with 2,000 kids back in 1995. And by 2004, Marathon Kids had grown to 7 additional cities outside of Austin, Texas. In 2010, we actually started a pilot program in 6 schools that we called the Wellness Team Initiative. And our 26.2-mile challenge was really great and was working, but we wanted to know what would happen and how it would change if we got more in depth, if we included more parents, and we actually helped parents form wellness teams in the elementary schools to kind of wrap the community around the 26.2-mile challenge. And we really just wanted to see what happened there. And a lot of really wonderful things happened. And we learned a lot from that pilot about the importance of including parents and making sure that the community was a part of this challenge. And it wasn't so solely focused on the child's experience. By 2012, we had grown to 6 additional cities. And last year, we served over 300,000 marathon kids in 841 elementary schools in 13 cities, and we had 20 wellness teams. So our history has been really great and rich, and a lot of really wonderful things have happened along the way that we're very proud of. But what we could not ignore anymore is what was happening to our children's health and the state of their well-being. So if you go to the next slide, you'll see just one more slide, sorry. You'll see just some statistics that you've all probably heard before, but that we felt as an organization we really couldn't ignore, or we really couldn't go any further without more purposefully aligning our program to the reality. So since 1980, obesity prevalence among children has almost tripled. In the state of Texas, about 30% of our children are obese. And what this means for us as a country is that, it's estimated that it will cost us $344 billion in medical-related expenses by 2018. So as a nonprofit organization, we found ourselves in this predicament where we had this 18-year-old organization that was really effective and had grown substantially, and people really loved and were attached to, and we weren't quite sure if we were actually achieving our mission as it relates to helping kids in the state that these stats provide for us. So if you go to the next slide, you all probably also know that because of those stats, in 2008, the U.S. Department for Health and Human Services recommended that children up to the age of 17 receive a total of 60 minutes of moderate to vigorous physical activity, or MVPA, every single day. So for me, this is sort of striking because this recommendation wasn't out when I was growing up, and I can only assume that it wasn't because we were always outside playing, and it wasn't necessary for the government at that time to tell us that we needed to be getting 60 minutes of MVPA every day. It was just something that we inherently got in the way that our lives were. In 2012, the government followed up with a study to say, how is our recommendation going? Is it changing anything, and what can we do to improve the recommendation? And what they found out, among some other things, is that they can't do it without schools. If we expect kids to get 60 minutes of MVPA every single day, we're going to have to partner with schools to make that happen. I think this report said that about 55 million kids are in public and private schools in the U.S., and they spend, anywhere from 6 to 8 hours in those schools every single day. So we're going to have to partner with schools to make sure that kids are getting 60 minutes of MVPA, so that the stats we showed on the previous slide can begin to change. And so with this reality, we really knew we had to do something, because we are in 841 schools, and our hope is that we grow that number to a whole lot more. And so we really needed to focus on how to align our programming to help kids get 60 minutes of MVPA. So if you'll go to the next slide, here's the big questions, right? So we asked ourselves, is Marathon Kids an evidence-based nonprofit organization dedicated to improving the health of children? And are we, in fact, providing them with the motivation, tools, and support in order to live happier, healthier lifestyles? Which is a very scary place to put yourself as a nonprofit. We depend on a lot of funding from other generous folks, and we want to believe that we're always doing a really good job. So to put these questions and to put these words in front of our mission statement and really put the spotlight on ourselves was a little bit scary, but also really empowering. So this is sort of where our journey begins. We decided to find out more about this MVPA thing I personally thought I knew what it was all about. You hear moderate to vigorous physical activity and you think you know what that means. But when we began to dig into the research a little bit further, we came across some surprising information. So if you go to the next slide, this is where our deep dive into MVPA begins. And as a running walking program, we wanted to understand MVPA as it related to distance over time and how our program metrics and goals and components could align to that. So we looked at 4 different things, and apologize for that numbering there on the right-hand side. Why is MVPA important? How is MVPA measured? Do we, marathon kids, help kids reach their MVPA goals? And if not, what can we do about it? So if you go to the next slide, here we talk about why is MVPA important. What we found here is that it's important for a whole host of reasons. So it's improved cardiorespiratory and muscular fitness, improved bone health, favorable body composition, reduced symptoms of depression, decreased likelihood of developing heart disease, decreased likelihood of developing type 2 diabetes, and more research is beginning to make the connections between those things and the classroom and kids' performance. So improved concentration, memory, and classroom behavior. And again, the research just keeps on coming out about how the health of our bodies, relates to the health of our minds and ends up changing our behavior. And so why MVPA is important was not a hard question for us to answer. In fact, I challenge you to find a piece of research that says MVPA is not important. So we got that, and we knew that was a good place for us to continue to focus. But the next question is, okay, well, how is MVPA measured? So if you go to the next slide, the answer to how is MVPA measured was a little bit surprising to us, because the answer is that there's really no cut and dry way to measure MVPA, and in fact, it's measured in a whole host of ways. We aren't going to go through all of those ways during this presentation, but we are going to focus on 3 of them because we felt like they most related to marathon kids and our program and our organization, especially that MVPA as it relates to distance over time. So the first way that we want to talk about how MVPA is measured is called metabolic equivalent of task, or MET, or METs. So we focused on METs and learned a little bit more about METs. And if you go to the next slide, here are some of the basics. So what is METs? It's the procedure for expressing energy cost of physical activities as multiples of resting metabolic rate. And that all sounds a little bit confusing, but a really nice way to break it down is to say that if you're an average sized human, that you're probably at 1 MET as you're sitting at your desk today. So if you're just sitting there nicely and you're not walking on a treadmill or doing anything else, you're probably at 1 MET. And the range is 0.9, which is what you are when you're sleeping, and can go all the way up to 23 METs, which is what you're probably going to be at if you're running about a 4-minute mile. So good luck to all of those folks out there that can run a 4-minute mile. But that's the range of METs. So let's say we're all sitting at our desk right now listening to this webinar, and you're at 1 MET. If you were to get your body at 2 METs, that means that you would be expending double the amount of energy you're expending just sitting at your desk. So what I would normally do if I'm giving this presentation in front of folks, I would make them stand up. So if you want to be super cool, you can stand up and say, okay, if I want to expend double the amount of energy right now, what would I do? And you'd probably stand up and maybe just move your body around a little bit, maybe take a couple of steps back and forth. And if you go to the next slide, Duncan, you'll see that once you get to 3 METs, and until you go to 5.9 METs, you're actually at moderate physical activity. So remember, MVPA, moderate to vigorous physical activity. To actually be in MVPA, you need to be at least 3 METs as an average size adult human. And the way we know this is something called the Compendium of Physical Activities. So you'll see a screenshot of that document there on the slide here. And this compendium is made up of a whole host of different activities. So you see here a lot of examples of bicycling, but it goes anywhere from running to gardening to weightlifting, you name it. It even has household chores listed in the Compendium of Physical Activities. And next to the description on the left, you'll see what the average size human MET level is at when they're doing those activities. And these have all been proven through lots of extensive research. And so back in the 80s is when this compendium was first created. And in fact, you all know Dr. Kelder very well. I found out during a presentation that he was a grad student that worked on this. So that's a little interesting bit of information. And if you look down at the bottom of the screen, you'll see that in order to actually get to vigorous physical activity, as an average size adult, you need to be at least 6 METs or higher. So imagine yourself again sitting at your desk, you're at 1 MET. For you to be in vigorous physical activity, which the government recommends our children and our adults do at least 3 times a week, then you need to be expending 6 times the amount of energy that you're expending right now sitting at your desk. So this was really interesting for us to find out. We didn't know this before we started diving into the research, and what we especially didn't know is how this translated to little kids. So this has all been figured out in adults for some time. Like I said, the compendium was created in the 80s. But if you go to the next slide, Duncan, in kids, it's a little bit different of a story. So there is, in fact, now a compendium of energy expenditures for youth, but that was not created until 2008. So you see that the government recommendation of 60 minutes and the compendium created for youth, both were done in 2008 when a lot of the stats and research started coming out about the state of our children's health. So we said, okay, well, how many METs do kids have to be in MVPA? And what the research is currently saying is that we aren't sure. The long-term research over time is not telling us what we know about adults. So while researchers have landed on kids needing to be at 3 METs or higher to be considered an MVPA, the research will tell you that that's sort of a temporary answer until they get more information. And a lot of researchers are arguing that kids probably need to be closer to 4 to 5 METs to be considered in moderate physical activity. So that was also really interesting for us, just to understand that we are, as a country, literally in the middle of figuring this out as we are reading about it. Just hasn't been done as extensively for kids yet as it had been for adults. So on the next slide, what you'll see is a detailed glimpse of that compendium for youth. So remember, Marathon Kids, we're a running and walking program, so we wanted to know, what does the research say in the compendium for youth as it relates to running and walking? And what we found out was actually really surprising. If you remember at the beginning of my presentation, I talked about one of the components of our 26.2 mile challenge is that we told teachers and students to run or walk the equivalent of a marathon over 5 to 6 months. But if you look at this detailed glimpse of the compendium for youth, you'll see that unless students are walking with a hard effort, they're probably not actually getting MVPA. So while walking is still good, we really wanted to help focus on making sure that our program was helping students toward their 60 minutes a day goal of MVPA. So what we're doing now as an organization is recommending that kids at least walk at a hard effort or run or jog at any effort in order to ensure that they are receiving some of their 60 minutes a day of moderate to vigorous physical activity. All right, so if you go to the next slide, the second way that we looked at measuring MVPA is steps per day. So you guys probably either are wearing your own Fitbit or equivalent, or you have some friends who are tracking their steps every day. And I was too. My mom, in fact, gave me a Fitbit for my birthday last year, and I was really excited about just learning about how many steps a day I was taking. But as we started doing this research and began to learn about steps per day as they relate to moderate to vigorous physical activity, once again, a few surprises landed, on our doorstep. So one is, if you're an adult and you're tracking your steps, chances are you probably have a daily goal of around 10,000 steps a day. And as an average adult, that usually ends up being about 5 miles a day. So adults typically take about 2,000 steps every mile. 10,000 steps a day, 5 miles a day. What does that mean? That means you should be doing the equivalent of a marathon about once a week. And so as I put my Fitbit on and began tracking, I realized just myself, wow, we're telling kids to do 26.2 miles over the course of 5 to 6 months. And if I do what my Fitbit tells me I should be doing a marathon at least once a week. And so that got us really to look more in depth about measuring MVPA through steps per day as it relates to the kids. So if you go to the next slide, here's just a baseline of what it looks like in our world. How many steps do kids get now? Well, studies will say kids from 6 to 19 years old in the United States receive the following amount of steps per day on average. So boys 9,500 and girls 7,900. It might be surprising or it might not be surprising to find out that girls actually receive less steps per day because they talk more. So the research will tell you that if you let boys and girls out for recess, the girls will stop and chat with their friends for a little bit before they go out to the soccer field and start kicking the ball around, versus the boys will immediately run out to the soccer field and start kicking the ball around. So I thought that was really interesting. But even more interesting is that my goal was 10,000 steps a day, and our boys and girls aren't even receiving that on average in the United States. And obviously you've probably already seen the sentence I have here below. Just as a comparison, a study was done on Amish kids 6 to 18 years old who refrained from technology, and they were averaging over 15,000 steps a day. If you'll just take a look at that 9,500 and that 7,900 and remember those two numbers, and Duncan, if you'll go to the next slide, this will put it in perspective for you. So if you break down steps per day for our youth, our boys are sedentary and our girls are considered low active. And we as an organization really felt like we could do a better job of helping figure out how to align our programming with getting kids more steps per day. So if you go to the next slide, and you just keep clicking, Duncan, until it comes up that says, who knows? So all of these things that are flashing on the screen right now are copies of actual studies we went through to try and find out how many steps per day should kids be getting. And the reason we took screenshots of all of these charts and put them up here is because the answer is nobody really knows. The research was really confusing, and there are a lot of ways that people measure how many steps per day kids should be getting, and it depends on where the research was and how they measured it. It was all really confusing until very recently. If you'll go to the next slide, a lot of people, including the U.S. Presidential Challenge Program, have agreed to just go ahead and say 12,000 steps per day for any gender of any aged youth will probably mean that they're getting 60 minutes a day of MVPA. So how about, as a whole, let's go ahead and settle on 12,000 steps a day until we do some more research. We discontinue putting out all of these different numbers and goals, and let's just go with this. So that's really great. It's a place for us to start, right? So a goal is all of our youth, boys and girls, should at least be getting 12,000 steps a day in order to most likely be receiving 60 minutes of MVPA a day. And one of the lead researchers on this stuff is a woman named Katrine Tudor-Locke out of LSU, who we got in touch with before we started doing this presentation. And what she told us is that when they put out the 12,000 steps a day goal, it actually had the reverse effect they were hoping. And what I mean by that is that kids who weren't even close to 12,000 steps a day, instead of being encouraged, got discouraged because they never thought they'd be able to reach that goal. So they're starting to backtrack on the way they talk about it. And if you go to the next slide, you'll see a quote here from Dr. Katrine Tudor-Locke, which basically says, while yes, kids should be getting 12,000 steps a day, we want to also tell folks that 7,000 steps a day is a red zone, and alarms should be going off if your child is only achieving 7,000 steps a day. You really have something to be worried about. So now, as an organization, we at least have a range, 7,000 to 12,000, and we know our goal is 12,000 or more, but at least we have, something to sink our teeth into and to focus on when we come up with new programming. So if you go to the next slide, the last way that we're going to talk about how to measure MVPA is steps per minute. or your cadence. How fast are you actually going? Because remember, the first way was METs, and for a kid, you probably need to be in 4 to 5 METs to be getting moderate physical activity, and at least 6 METs or higher to be getting vigorous physical activity. And we know we have a goal of 12,000 steps a day, but how fast do we need to be going in order to A, get those steps a day and make sure that we're getting 60 minutes of MVPA in those steps? So if you go to the next slide, you'll see a quote again from Dr. Tudor-Lock, who basically said, for your presentation, Erica, go with 100 steps per minute, and anything above that is cream. So the reason that she told me this is because as we were doing the research, we found that steps per minute was much like steps per day, and that the research was kind of all over the place, and nobody could really agree just yet on how many steps per minute kids should be getting in order to be in moderate to vigorous physical activity. But 100 steps per minute is what has been proven as MVPA for adults. So as long as you're getting 100 steps per minute as the average size adult, you're most likely in moderate to vigorous physical activity. And so right now they're actually in the middle of an NIH study, and it should be published in the next few months. And that will tell us probably that kids need to be getting more than 100 steps per minute, but Dr. Tudor-Lock suggested that we say 100 steps per minute for our programming guidelines, and anything above that is cream, and watch out for the studies that will be coming in the next year or so. All right, so if you go to the next slide, I'm going to walk you step by step, Duncan, through when to press the button. But basically, here is kind of a summary of all of the research we've done. What did we find out, and how can we make good use of it as a running, walking program in elementary schools? So if you'll click once, we know that MVPA is good, and 60 minutes or more of MVPA is really good for youth. And that wasn't questionable. It can't be debated. I dare anybody to debate it. We know that that's where we need to be focused and that we can do something to help. And if you click again, you'll see that we want to be shooting for at least 100 steps per minute as a pace. Okay, if you click again, 12,000 steps or more a day is great. And then one more time. And kids average 2,500 steps per mile. And this is just a number that a lot of folks go with as an average. Of course, it depends on how tall the kid is and what their instep is, and it depends on a lot of things. But just as an average, kids take about 2,500 steps per mile. So if you click one more time, this is how we as an organization put this all together. So let me just walk you through this equation. Let's say you do marathon kids 20 minutes a day. So your kids in elementary school or at home, like Kate did with your family, Duncan, walk fast or run for 20 minutes a day every time they chart their miles for marathon kids. We know that that's 30% of your daily MVPA. So if you click one more time, an arrow should pop up just to coordinate that 60 minutes a day with however long you decide to do marathon kids. And 20 minutes a day is just something we chose to use for this equation as an example, because we know that from what our teachers tell us, that's the most common amount of time they spend on marathon kids a day. And if you click one more time, if you take that 20 minutes a day and you multiply it by the cadence, which we created a big range. So we started with 100, which we know Dr. Katrine Tudor-Lock told us was the baseline, and we took it all the way to 160 steps a minute, because that was the most we could find with any accelerometer on the market for kids today. So kids are going 20 minutes a day. Let's say they're doing at least, or they're doing between 100 and 160 steps per minute. If you click one more time, that equals 2,000 to 3,200 steps every 20 minutes, which is 17 to 27% of your daily recommended steps per day. And if you click one more time, we're going to divide that by 2,500 to see how many miles the kid is getting, which equals 0.8 to 1.28, depending on the steps per minute. So if you click once more and once more, you'll see what we landed on is a baseline recommendation of kids going 1 mile for every 20 minutes. So we believe as an organization that if kids are walking fast or running, they should be at least getting 1 mile for every 20 minutes. And we came up with this whole theory before we tested it at all. And what we found, even just after a little bit of testing, is that this is a real baseline. Almost all kids, almost all kids in elementary school, no matter that are in decent enough health, I should say, to be able to walk fast or run, are being able to get 1 mile in 20 minutes. So we're still going to use this as our baseline and continue to build off of this. So if you'll go to the next slide. The next thing we wanted to ask ourselves is the very big question, right? Do we marathon kids help kids reach their MVPA goals? We know what we've been telling teachers. We know now from the research what it takes to get your MVPA every single day. Have we been helping kids do that? So if you'll go to the next slide, you'll see another equation. We just took one example. Our teachers tell us that they do marathon kids on average 3 days a week. So let's say you do 3 days a week and you do it for 20 minutes a day. If we're going with that 1 mile every 20 minutes, then your kids should be getting at least 3 miles a week. Most of our programs will run about 20 weeks, and that ends up being at least 60 miles, which obviously is much greater than 26.2 miles. And so while we know giving kids a goal of 26.2 miles over the course of 5 to 6 months has done a lot of really wonderful things, we did not feel like after our research it was helping kids purposefully reach their MVPA goals. And so the next slide is the big question: what are we going to do about it? So if you go to the next slide, here's what we're doing about it. We're tying yesterday's successes with today's technology and research, and we're focusing on 6 key components. So these 6 key components that I'll go through very quickly here are focused around Marathon Kids' 26.2 mile challenge, but obviously are applicable all over the place. So the first key component that we're focusing on is to keep it simple, flexible, and fun. Our program is implemented in a number of ways at a number of schools based on what works for that school, and we wanted to really stay true to that because we know that that's really important to our constituent base. We have customized goals now, which is something different. So we actually provide our teachers with a 1-page worksheet that allows them to put in the days of week, how many days a week their kids will run, how many minutes a day they will run, and encourages them to shoot for at least 1 mile every 20 minutes, and then over the course of time allows them to create an end goal. So it's not just focused on 26.2 miles. What we say now is at least 26.2 miles, but we know that our kids are most likely already running or walking a whole lot more than that, and if they're at least walking fast, then they should be definitely getting more than 26.2 miles in most of the ways that our teachers implement the program. So now we actually just provide those tools for teachers to be able to do that math very simply on their own, and it's research-based, and you know, we have the goods to back it up so that they can tell their kids with purpose that this is why we're doing it this way. And that, you know, it doesn't change anything. It allows them to still run or walk during recess or PE or classroom breaks or running clubs or what have you. That still is the same. So if you go to the next slide, the second key component that we're focusing on is helping schools and organizations meet their goals. So we know that schools and organizations are already overloaded with all kinds of things. So we've aligned our programming now with the state and national standards. We've done a lot of work with the great folks at Catch to align our programming with the coordinated school health efforts, and we provide reporting. So if you go to the next screen, this is just an example of some of the end of the year reporting that we will provide to district leaders and teachers just to make sure that they have record of the great accomplishments they've done throughout the year. So the third thing, the next slide, the third thing that we're focusing on is helping kids meet their goals. So again, they need 60 minutes a day of MVPA, and in order to get that, they probably need about 12,000 steps a day. And so for the first time, we've actually created messaging to our kids. An example of it you can see below. But we start by educating them on this 60 minutes a day and 12,000 steps per day in a way that we feel like elementary school kids can understand, and just just them knowing those two numbers and what they mean and why they're important is where we're starting. And then hopefully over time being able to tie Marathon Kids to those goals is really great. So the fourth component that we're focusing on, oh sorry, I should say that this slide just shows another way that we're helping kids meet their goals. So on the left there is our mileage log with our fuel log, and that's what we used to provide to kids. But this year we're providing them a second marathon mileage log. So you'll see, if you can look closely underneath the orange spots, the miles actually start at number 27. So kids now have other fruits and veggies to try, and they start at mile 27 and just keep on going. So the fourth component that we're focusing on, if you go to the next slide, is bringing the community together. If you remember at the beginning of my presentation, I talked about family being an important part, and we're really trying to provide online resources and tools, do webinars like the one we're doing here to be sure that all of our community knows why this is important. The next slide will just show you some pictures of us actually going into schools and you know, helping educate teachers and parents and students along the way. So the fifth component that we're working on and focusing on is getting parents involved. We're doing this in a really heavy way this year. So what you see on that screen is what we call our parent pledge. This not only educates parents on the 60 minutes a day and the 12,000 steps a day, but it asks parents to ask about the progress of their kids' marathon. It asks them to run or walk with them if they can, to offer fruits and veggies at home if they can, and to limit their children's screen time to no more than 2 hours a day. So we're really trying to make a heavy effort to get the parents to say, yes, I'm on board, I know why this is important, and I'm going to do my part. And then the final component that we're working on and focusing on is to continue to reward and incentivize. I talked about that earlier, and we know that this piece works, so we're going to keep doing it. So what are the next steps this year? If you go to the next, thanks. This year we've given out 240 scholarships in our 13 service areas thanks to our generous sponsors. And for the first time in the history of our organization, we have created a pathway for any school or organization to do Marathon Kids at their school or organization for $8 a student. And that $8 a student encompasses all of the things I just talked about. And it doesn't matter where they live. So we used to only service folks in those 13 service areas, but now we've boosted up our technology and created you know, a price point that we know helps our nonprofit be able to continue what we have to continue, and now anybody can play, if you will, which is really exciting for us, and we've got a lot of really great interest in that, and starting to do that for the first time this year. So you see an email address up there, programs@marathonkids.org, that you can email if you feel like you know a school or organization anywhere in the country who might be excited about learning more about Marathon Kids. And we're going to keep asking ourselves the tough questions. So we just got approved by the Austin Independent School District Department of Research and Evaluation to do a research on this new model in schools this year. So we'll be doing that to see how does it actually work? Are kids getting more MVPA by following our recommendations? And then, of course, we'll adjust accordingly. So if you go to the next slide, Duncan, I think the rest of our time here we have dedicated for folks to ask any questions they may have.
Great, thank you, Erica. That was a really informative presentation, and I'm sure was of interest to our audience. So one question that we have comes from Grant Maddox, who wants to know a little bit more about how Marathon Kids is funded and whether it's possible to get samples of logs and fuel charts and some of the other resources that you mentioned.
Yeah, thanks, Grant. We are funded mostly through grants and sponsors right now. Of course, now we have this new pathway for participation where folks can actually pay the $8 a student on their own, and that, again, is very new for us, and we hope that that will be another way that we continue to survive. And yes, you can absolutely get some samples of things. What we call our welcome packet, which is what we give to our champions once they sign up for the program, is proprietary, but we're happy to share with you whatever we're allowed to share and help you do whatever it is you're trying to accomplish. You can either email programs@marathonkids.org or Erica, ERICA, @marathonkids.org, and we'll be happy to share whatever we can with you.
Great. And just another reminder, please send in your questions now if you haven't already, and we'll ask them. So here's another one that came in from Patricia Brewster, and it asked whether the $8 per kid could take place in her locality in Colorado, and how she would connect with you about that.
Yes, it can. We're very excited to be able to finally spread our program beyond our 13 cities. So it is not limited to any location. And if you're interested in getting your group of kids signed up, you just need to email programs@marathonkids.org and tell us a little bit more about yourself, and we'll be sure to get you in our system so that you can sign up.
Great. I have another question that I'll ask while more questions are coming in, and I think people would love to hear more about what are some of the challenges and obstacles that you guys face when implementing this program either at a school level or at a district level.
That's a great question. Well, one of the challenges is that we are an 11-person full-time staff, and we have over 250,000 marathon kids. So we rely very heavily on the champions implementing the program on the ground to ensure that the recommendations we make are being implemented. Because we don't have direct access with the marathon kids themselves, on a daily basis, we don't collect their specific data. We rely on those champions really heavily. So a couple of things we've done this year is create a parent champion role, where we actually are asking one parent at each of our schools to be in charge of the program with a teacher. And the parent's main role there is to reach out to the other parents so that it's not just all on the teacher to spread the word, but that the parents are taking a real active role in this journey as well. And you saw the parent pledge that we created, and we'll be providing our own trainings and webinars for those parents along the way who sign up to be Marathon Kids parent champions. Get them connected with things like the coordinated school health efforts already happening at their schools, and make sure that they're plugged into those efforts. So we're trying to close some of those gaps, but one of the things we run into is just not having the capacity to reach 300,000 kids with an 11-person staff.
Yeah, and in that vein, we also have a question from Hassan Mavi asking if you could talk about teacher education for the program.
Yeah, that's a great question. What we have historically done, Hassan, is just send what we call a registration packet to our teachers. And now we have, over the past summer, created an 80 touchpoint guidebook. And it starts with a pre-registration packet, which is much like it was historically. But once you actually sign up for the program, we then send you the welcome packet. And the welcome packet is our first sort of training on the program for our teachers. I should back up. We also hit the ground a lot over the summertime and go to in-services and talk to teachers directly about Marathon Kids. But online, once they sign up, we send them a welcome packet. And we've worked really hard to make sure that everything they need to know to begin and to run the program is part of that welcome packet, including how to talk to your administrators, how to talk to your parents, ideas on how to keep the program fresh throughout the year. And we also use social media and webinars and connections along the way. We give each of our school champions a personal login to our website, so they have access to the back end of our portal where we can share resources specifically for folks who are running the program, and they can share with each other to learn best practices and get more ideas and things like that.
Great. We have another question from Bernice Castillo. Is there a minimum or maximum amount of kids that need to register in the school program?
Yeah, thanks for asking, and I'm sorry I didn't mention that. Right now, the way our program is set up requires at least 15 kids to be a part of the program, and the reason that is because, like I said, we provide T-shirts to each of our finishers, and we found a couple of years ago that it was not cost-effective for us to mail any less than 15 shirts. It ended up costing us a whole lot more than $8 a student, which as a nonprofit, we just literally couldn't afford. So right now, you have to have at least 15 kids signed up to be a part of the program, so that when we mail you your T-shirts at the end of their journey, it allows it to stay $8 a student. I should mention, though, now that in January we have a new program launching called Marathon Families, which will allow a family to sign up for Marathon Kids, Marathon Families program, and they'll get to do their own sort of journey, kind of like the 26.2-mile challenge, but it will have a lot of other cool stuff that will be more focused on the family doing it together.
Great. That's a great idea. We just have time for one more question, so I'm going to take one that I think a lot of people would be interested in, asking whether there are parent handouts that are in Spanish.
Yes, that's a great question, and there sure are. All of the information we give out to parents also comes in Spanish.
Okay, great. Well, for those people who did not have your questions answered, I'm sorry that we ran out of time, but you certainly can feel free to email me at the address shown here, or Peter Cribb, who's our National Catch Director, and we will get your questions answered or get them to Erica to be answered. So once again, thanks very much for attending, and if you didn't see the whole webinar or you have friends that would like to see it, the archive on catchusa.org will have a recording within about 48 hours.
Thank you so much, Duncan.
And thank you, Erica, and thanks to all our attendees.